My name is Trish Neely, and I'm the Chief Compliance Officer for FBMC Benefit Management Incorporated. And today I'm going to introduce you to 7 of the top requirements for healthcare reform that you need to be aware of right now. The shift in mandatory coverage refers to the fact that an adult child to age 26 must be covered under their parent's plan if the parent's plan offers dependent coverage. If the plan is a grandfathered plan and the child has access to other coverage, for example through their own employer, then the parent's plan does not have to cover the child. For anyone under 19, plans are no longer permitted to refuse to pay the expenses for someone who has had a pre-existing condition. For example, if someone under the age of 19 had something along the lines of an asthma attack and it was a pre-existing condition, they didn't just acquire asthma, then the plan prior could say that they were not going to cover that. But now under reform, they are no longer allowed to do that for anyone under age 19, and effective in 2014, it will be for any age group. Under healthcare reform, there are no longer permitted any lifetime limits on care. And the reason for the change was because many people were filing for bankruptcy as a result of exhausting their lifetime limit on care. And particularly an employer that had a self-insured plan, their annual cap was pretty low. Some of them had less than $2 million, and let's say, for example, you give birth to twins and they're premature, you can very quickly exhaust that maximum lifetime limit. So under healthcare reform, there are no longer any lifetime limits. Annual limits are definitely being phased out. That was one of the things that the drafters of the legislation wanted to make sure happened. So currently, the annual limit is $750,000. Beginning in September of 2012, that limit will increase to $1.2 million, and by 2014 it will be completely phased out. So there will be no more annual limit on essential benefits. Now, the difference between essential and non-essential benefits is that an essential benefit would be emergency care, hospitalization, maternity, as well as newborn care, those types of things, where a non-essential benefit would be more along the lines of dental care or vision care. Under healthcare reform, you can no longer have a copay or a deductible on preventive care services. For example, on a mammogram or a colonoscopy, pap smears, any of those types of things where some employers' plans may have said, you know, in the past that you pay the first $20, we'll pick up the rest. Under healthcare reform, preventive services must be paid with first dollar by the employer. Well, a rescission means that something can be taken away. And the way that that worked was that prior to healthcare reform, a plan, well, I won't say that they looked for ways to rescind coverage across the board, although I will say that a few may have done that. What they were looking for was some way to not pay the coverage. And under healthcare reform, you can no longer rescind somebody's coverage just because they get sick. Now, what's really, really important is that rescission also means that you cannot take away someone's coverage if you all of a sudden discover that they were ineligible for coverage to begin with, unless you can prove fraud or misrepresentation. Now, for employers, what this means is that employers are going to have to be very careful to make sure that they do their dependent audits when employees sign up for benefits, just to assure that They have on board only those dependents who are eligible for coverage. Under healthcare reform, you have to go to your doctor to seek a prescription for an over-the-counter drug if you want to have that over-the-counter reimbursed through your tax-favored account, either your medical flexible spending arrangement, your health reimbursement arrangement, or your health spending account. The top 7 current requirements under the new healthcare reform law include mandatory coverage to age 26, pre-existing conditions disallowed, no lifetime limits, phasing out of annual limits on essential benefits, preventative services covered at 100%, no cancellations if you get sick, and over-the-counter drugs now require a prescription in order for reimbursement. For more information, please visit fbmc.com.